Hey everyone! Today let's talk about a condition that's often called the suicide disease because of its severe pain, trigeminal neuralgia. Sounds scary, right? But don't worry, I'm here to break it down for you step by step. First things first, what exactly is trigeminal neuralgia? It's a chronic pain condition that affects the trigeminal nerve, which carries sensation from your face to your brain. Imagine a sudden, electric shock-like pain on one side of your face. That's what people with this condition experience. Let's dive into the pathophysiology. The trigeminal nerve has three branches: ophthalmic, maxillary, mandibular. Ophthalmic covers your forehead and eye. Maxillary covers your cheek. Mandibular covers your jaw. In trigeminal neuralgia, something irritates this nerve, usually a blood vessel pressing against it, near its connection with the brainstem. This pressure damages the nerve's protective coating, called myelin, which makes it supersensitive and causes intense pain attacks. Now, what causes this condition? The most common reason is a blood vessel compressing the nerve, but it can also happen due to multiple sclerosis, tumors, or after facial injuries. Sometimes, the cause remains unknown. So, what are the signs and symptoms? The main symptom is sudden, severe, stabbing pain on one side of the face. Triggers include brushing your teeth, chewing, talking, or even a gentle breeze. The attacks usually last from a few seconds to a couple of minutes, but the pain can be so bad that it disrupts daily life. Clinically, the pain often follows the path of one or more trigeminal branches. There's usually no numbness, just intense pain. Over time, people may avoid eating or speaking for fear of triggering an attack. So, how do doctors figure out if someone actually has trigeminal neuralgia? Let's break down the investigation and diagnosis, step by step. First, it all starts with a detailed patient history. When it started, what it feels like, how long it lasts, what seems to trigger it. They'll want to know if the pain is sharp, stabbing, electric, and if it always affects the same side of the face. This helps them spot the classic features of trigeminal neuralgia. Next comes the clinical examination. The doctor checks for numbness, checks for weakness, checks for other nerve problems. They might lightly touch different areas to see which parts are sensitive or trigger pain. This step helps rule out other causes of facial pain, like dental issues, migraines, sinus problems. But diagnosis doesn't stop there. To make sure nothing else is pressing on the trigeminal nerve, like a tumor or an abnormal blood vessel, doctors often order imaging tests. The most common is an MRI scan. MRI shows detailed pictures of the brain and nerves, helping them spot any underlying problems that could be causing the symptoms. Trigeminal neuralgia can sometimes mimic other facial pain disorders. Accurate diagnosis means the right treatment can begin, and other serious causes won't be missed. In summary, patient history, clinical exam, imaging tests. These steps work together to help doctors crack the case and make sure nothing is overlooked. Now let's talk about medical management. First-line treatment is usually medication. Anticonvulsants like carbamazepine or oxcarbazepine to calm the nerve. If medications fail or cause side effects, surgical options can relieve pressure on the nerve. But what about physiotherapy? Physiotherapy can play a supportive role. Gentle facial exercises, relaxation techniques, and pain management strategies can help people cope. It's important to work with a trained physiotherapist who understands this condition. To wrap up, trigeminal neuralgia is tough, but with the right diagnosis and management, many people find relief. If you or someone you know is dealing with facial pain, don't ignore it. Reach out to a healthcare professional. Take care, and remember, knowledge is power.